Dr. Nicholas Cummings has been a visionary psychologist for many, many years. He started to do some really innovative work with Kaiser Permanente in the late 70s and early 80s. His work there was as chief psychologist. He was integrating behavioral health into medical practice with the Kaiser Permanente physicians there. He did a lot of collaborative care, and he noticed the difference that that made versus standard treatment, which was having psychotherapy without any connection to medical health. He noticed, that the body and mind were connected, and that when treated in collaboration, patients improved faster and their experience was better with their overall care. So he started writing about this and doing health utilization and cost studies and publishing on that topic quite extensively, and gathered a lot of other psychologists and medical providers and researchers around him. They hosted several annual conferences in Reno, Nevada, based on the evidence for integrated behavioral health into medical care, and especially in primary care environments. And at the same time, he was also doing a lot of clinical training for master's level clinicians as well as psychologists in the Biodyne model, which was his signature therapy model that he used in American Biodyne, which were the nation's first managed behavioral health care organizations. There were about 25,000 therapists nationwide who were trained in the Biodyne model, and then additional ones were trained through Magellan Health and Blue Cross Blue Shield of Arizona once Magellan bought American Biodyne. While he was training clinically and publishing on financial cost savings analysis and return on investment for evidence for integrated care, he noticed that there was a pretty huge gap in training for the education of behavioral health care providers, and he realized that if the current trajectory of education and training programs remained the same, medical care environment would never be integrated because there would not be a trained workforce that would enable that jump, that leap to happen. So he advocated for a new and improved training program for behavioral health care providers. Because Dr. Cummings has never been one to wait around for someone else to do what he thinks needs to happen, and because he's generally been very far ahead of his time, he decided to create his own doctoral program. So working closely with his daughter, he blended his entrepreneurial expertise and his daughter, Dr. Janet Cummings' expertise in medical literacy, which is pathophysiology and psychopharmacology and neurology together, and both of them had the great clinical expertise of master level psychotherapists. So together, entrepreneurship, behavioral health interventions that are appropriate and effective for primary care settings, as well as the medical literacy that behavioral health providers had not been, given or trained in previous programs together, created a new and improved behavioral health provider who would be ready to hit the ground running and work shoulder to shoulder with primary care physicians and specialty medical providers as part of the integrated interdisciplinary medical team. So that's the Doctor of Behavioral Health program history. Cummings Graduate Institute was founded by Dr. Nicholas Cummings and his daughter, Dr. Janet Cummings, to meet that educational need, to offer the Doctor of Behavioral Health from an institution that was solely focused on the integrated care effort and really applying all of the literature for the many years that have been published, studies and studies. I think there are over 80 randomized controlled trial studies that provide evidence for the effectiveness of integrated healthcare in treating chronic and comorbid diseases, which are plaguing the United States and costing us lots and lots of money. So this institution is primarily focused on solving those problems by applying the research that we have access to, as well as continuing to do the research that we know needs to be done in these chronic and comorbid diseases, finding new solutions and innovative ways to offer clinical pathways that save healthcare dollars and improve patients' lives, as well as the providers' lives who treat them.